Oh my gosh.
Well, some people unfortunately don't have a choice about going home. Good morning, everyone. Bonjour tout le monde. As we know, pediatric healthcare in Ontario is against the ropes. Emergency departments are overwhelmed with excessive wait times. Pediatric critical care is dramatically over capacity, with frankly heroic efforts to maintain standard of care, such as opening second ICU units, drawing down surgeries, redeploying staff, and transferring kids to adult ICUs, something that I have never heard of before. Parents are struggling to obtain even basic medications like acetaminophen and amoxicillin. Now, before proceeding, I want to acknowledge all of our healthcare workers who are valiantly on the front lines, literally moving heaven and earth under never before seen circumstances to do their best to deliver care that our children need against all of the odds. But healthcare workers aren't the only ones who need to work hard. We are looking for leadership from the Ford government. We've been waiting all summer and, in fact, warning about this precise scenario, and we continue to expect leadership without getting it. Doug Ford and Sylvia Jones need to understand it's not good enough to focus exclusively on emergency departments and ICUs. We need to take steps to reduce the demand on our acute care institutions in the first place. And that's where public health has a role to play. And today I'd like to draw attention to the lack of any meaningful efforts by this government to promote vaccination. This is especially important because we actually have an adequate supply of COVID-19 bivalent vaccines as well as influenza vaccines. And the current vaccines are actually well matched to the circulating strains of these viruses and could have a profound impact on curbing transmission this fall and winter, and therefore reducing the demand on our healthcare institutions in the first place. And despite these facts, despite the availability of these vaccines, since September, only approximately 1.5 million doses of bivalent vaccines have been administered across our country, across our province, since they became available on September 12th. Only 31.5% of our population, 31.5% of our population has not had a COVID booster dose at all, even though it is recommended. And for our children under the age of 12, only 24.9% of them have completed a primary series of the COVID vaccine. For children under the age of 5, that number is only 2.3%. At a time that our pediatric emergency departments and intensive care units are completely overwhelmed and over capacity, it's only 2.3%. As it relates to influenza, surprisingly and disappointingly, there is no data yet available about how many Ontarians have opted to take the vaccine. But there's no reason to expect that it's anything different from what we've seen with the underwhelming COVID-19 vaccination rates. And although I don't have that data, I was in a meeting with senior Ministry of Health officials yesterday who acknowledged that vaccination is underwhelming and that more can be done. But nothing was promised. And so today we're here with a few key messages. To the public, please seek out and update your vaccinations for COVID-19 and influenza. As I mentioned, they're safe, they're well matched to circulating strains of these viruses, and you can get them at the same time. I just got both of my boosters this weekend. And to the government, we need you and call upon you to immediately provide updated statistics on vaccination campaigns for influenza and COVID-19. We further call for you to support a large and sustained public health campaign that will increase education and uptake about vaccinations. And we also want to see updated statistics on the state of our healthcare system in the first place, which can help people make accurate risk assessments instead of being told by this government that everything is okay, because clearly it is not. And finally, I want to repeat again our call yesterday for universal masking in schools and on public transit. With that, I'd like to turn it over to John Fraser.
Thank you, Adil. Adil has just talked about three things that the government needs to do to protect our children's hospitals and our children. And as he said in his last remark, there is one thing that we can do right now, and that's universal masking in public transit and our schools. Here's why. Kids, sick kids, are having their surgeries canceled. Sick kids are filling ERs to the brim and overflowing. All because the Premier is afraid to do what's necessary and that it might be unpopular. The Premier is okay with ERs filling to the brim and overflowing with sick kids on his watch because people might not like what he decides. No one likes wearing masks. But if the alternative is more very sick kids, if the alternative is opening a second emergency room or a pediatric ICU like they did at CHEO in Ottawa, maybe, just maybe, it's time for the Premier to display an ounce of leadership and do the right thing for once. And we'll take your questions.
I want to ask you about Ottawa and CHEO. The situation is very bad there. Even people from Gatineau are starting or are really worried and have to fly, hospitals have to fly kids to Montreal, Quebec City. Comment on that?
CHEO serves more than just Ottawa and the region. It serves West Quebec and serves a lot of Ontario and patients from Nunavut. Lucille Collard and I were there last week. The situation is really serious. When you open a second pediatric ICU, one just had to go and see the chairs lining the hallways. I've been there with three kids and a couple of grandkids to ERs, and I've never seen anything like that. And so kids need to be able to get care. And the Chief Medical Officer of Health said yesterday, we're monitoring the situation. If they start canceling surgeries, we'll do something. Read a paper. They're canceling surgeries. Watch TV. They're canceling surgeries. Why must we wait again to do what we know is right? Which are the things that Adil described, and start masking everywhere. We need to mask in more places than just public transit and schools, but that's an important place to start, and it should send a very clear message. That's why we're calling for that.
But
because
not happening, though. Yesterday, the top chief doctor highly recommended it, and you're not seeing a lot of people masking up right now today.
You want to respond to that?
Certainly. So, our our call for universal masking in schools and on public transit are in the highest risk, are in the areas that we perceive to be highest risk for the children, for the individuals that are suffering the most currently in our healthcare system. I actually find it very peculiar that Dr. Moore spoke and gave his recommendation for public masking indoors, and literally all of us assembled at Queen's Park in the chamber at 10:30 for question period, and all of the Conservatives, the vast majority of the Conservatives, were not masking after the CMOH that they selected had just made that recommendation. But we have, I think a cardinal principle of public health is to help and support people in making the best choices that they can make of their own volition. And so, I think it's, we have been calling for enhanced masking measures, for increased uptake of masking. We're seeing a little bit of it, but we are calling for masking, particularly in schools and childcare centers, because this is where unequivocally our healthcare system is stretched well beyond capacity, where care is getting compromised, and where we can have the biggest impact in stemming the extreme surge that we are just at the beginning of.
So, the announcement that the Chief Medical Officer of Health made yesterday should have happened 4 weeks ago. Right? Should have happened 4 weeks ago. In fact, he said kind of the same thing 4 weeks ago. But we can't have a Minister of Health or a Chief Medical Officer of Health whose availability is like Wyerton Willie's when we're in the middle of an emergency. No, this summer we had a similar ER situation, and we couldn't find the Minister of Health for 5 weeks. How in any way is that acceptable to anyone? How is that in any way acceptable to the Minister of Health? How in any way is that acceptable to the Premier? We can't just appear once every 4 weeks and say, we really want you to wear masks. It's a message that has to be repeated day after day after day. The message that people need to be vaccinated, that vaccinations are safe and effective and they protect you and your family, needs to be repeated every day. People need the facts. I think Adil put that out very clearly. They need to know the facts. They need to know vaccination rates. They need to know what the situation is in our hospitals. They need the information to make an informed decision.
And why do you think the government is not doing so, is not pushing for more vaccination?
Because I believe the Premier believes it will be unpopular. And the problem with populists are, which the Premier is that populists are very focused on remaining popular. And that drives their policy decisions. And as a result, they wait and they wait and they wait until sometimes you're in a situation where you have to make that decision. And then he throws up his hands and he says, I have no choice. There's no other explanation other than that. There's no other explanation for inertia. I think, I just, as I said earlier on, the Premier just needs to step up and for once do the right thing the first time instead of waiting 3 or 4 weeks. It's really very frustrating to watch this.
So in the meantime, do you think municipalities or local governments should or could introduce their own mandates for masking?
So I'm trying to understand the mechanism by which they can do that. If they can do that, I think they should be able to do that. Earlier this spring, the government refused, I think, the Hamilton board to extend their mask mandates. So they can do that. But what we're looking for is leadership. There's a vacuum of leadership, a total vacuum of leadership. The Premier says, wear a mask whenever possible, and he sits there for an hour without a mask on. I mean, people can make their own choices. But if he says, wear a mask whenever possible, and he doesn't, what's the message? It's...
John, what would you like to see? Would you like to see like a radio, TV, social media, advertising blitz where every time you turn on the TV, you get an ad about get a shot, wear a mask,
Yeah,
that kind of thing? We don't really see that. Like when I get on the subway this morning, for example, I'm staring at a big poster that says mask strongly recommended on the TTC. So I don't know how.
I just think, if you look in, I think in the state of Massachusetts, which I always have a problem pronouncing for some reason, I'm watching their TV, watching games, Patriot games. They were just pumping away at TV advertising in between, in timeouts. They invested very heavily in that. I look, what we could start? Let's take Canada's Premier's ads off. We already have the buy. Let's just insert a good, strong message that says you need to do this. I think that's more important right now than trying to foist the blame for what's going on in somebody else. We all have responsibility, and the most responsible, intelligent thing to do right now is to actually say to people, we need to mask, we need to mask, we need to mask. Vaccines are safe and effective. Vaccines are safe and effective. Vaccines are safe and effective, and they're going to protect you. And we have to say that again and again and again. And the Premier may think that that's unpopular, that people don't want to hear that. The job is to tell people sometimes what they need to hear, not what they want to hear. Thank you.
Thank you, gentlemen.
Thank you.